Welcome to our mini training session on the benefits of using social media to connect with younger clients in counseling. We are glad you are here. You are joining us today because you are counseling a young family member of someone who was recently diagnosed with a terminal illness, or a young family member of someone who has recently passed. We hope to bring you some insight into how teenage clients grieve and equip you with tools necessary in order to best serve your client. Here are our 4 main objectives. Objective 1, introduce research on the intersectionality of grief and social media for emerging adults. Objective 2, understand how social media can support the journey through grief and define our part as clinicians in the journey of grief. Objective 3, spend time engaging in social media ethically and effectively for our emerging adult clients. Objective 4, establish further ventures that could enhance the research in this field. Are you ready to embark on this journey? All of us clinicians are constantly pioneering new ways to be effective counselors. While we navigate the many types of treatment available, we need to be hyper-aware of our clients who are from younger generations. In a time of grieving, our young clients are especially vulnerable. They are vulnerable physically, emotionally, socially, and oftentimes financially. There are many different modalities of treatment for grief and loss, yet many of these aren't always affordable to clients. Social media is an easily and globally accessible tool that can be used in the framework of treatment. Research shows that small, informal coping groups are preferable to the rising generation, which is another reason why social media can be a powerful tool.
The most common modalities used in grief therapy are cognitive behavioral therapy, acceptance and commitment therapy, traumatic grief therapy, complicated grief therapy, and interpersonal therapy. Each has been shown to be effective in younger populations when used in combination with other coping strategies and tools. It is absolutely crucial that our counseling practices always meet the clients wherever they are at. Grief is processed by every person differently, and we cannot speed or slow down the process that each client may go through. The goal of using social media is not to replace standard recommended practices, but to be used as a supplement to treatments that are currently available to meet our clients' needs in a way that suits them best. The ultimate goal of therapy is to reconnect our client with others, help them process their emotions, and find safe and healthy ways to navigate their grief process. We know that social connection can be one of the most powerful preventative factors in treating mental illness, and the opposite is also true. In her research on courage and vulnerability, Dr. B. Brown coined the phrase, "Disconnection is disease."
It is crucial that we adapt our current practices to include technological advancements. Social media is one such advancement that can offer significant benefits to our younger clients, especially when it comes to fostering personal connections. In today's digital age, social media platforms and other virtual tools can help bridge the gap created by physical distance, particularly during challenging times like end-of-life care. A New York hospital provided structured scripts for virtual end-of-life conversations that took place over Zoom. This was especially helpful for patients who could not have physical visitors in the hospital, as was often the case during the pandemic. We know that family members who have the opportunity to say goodbye at the end of life have lower rates of depression and complicated grief. By using the video goodbye tool, patients could combine video technology with a structured approach to communication, making these encounters more meaningful and helping to ease the trauma of these unprecedented times while staying connected with loved ones. Encouraging your clients to use social media for personal connections can help them feel less isolated. For instance, setting up a private Facebook group for family members to share updates, memories, and messages of support can create a virtual space of comfort and togetherness. Similarly, platforms like WhatsApp or Zoom can facilitate real-time video calls, allowing clients to see and hear their loved ones, share important moments, and maintain a sense of presence even when physical visits are not possible. As clinicians, it's important to guide your clients on how to use these tools effectively. Show them how to set up private groups, manage privacy settings, and use video call features. Offering structured scripts or guidelines for virtual conversations can also help them navigate these interactions more comfortably, ensuring their needs and emotions are properly addressed. Recognizing and embracing these advancements is important, as they can significantly improve the therapeutic process and support clients in new ways. Integrating these tools can help your clients maintain meaningful connections, creating a sense of community and support during tough times. We also recommend clinicians consider how social media can serve our younger clients as a tool for emotional release and expression during grief. Studies have shown that younger clients prefer less structured and more open ways of expressing themselves when dealing with grief. Platforms like Instagram and Facebook, and even anonymous forums like Reddit, allow users to share their feelings and experiences in real time, offering a natural and accessible outlet. Encourage your clients to use social media as part of their grieving process or navigating end-of-life care for a loved one. This might include posting stories, sharing thoughts, or even venting. These activities can help them process their emotions and connect to a broader community that understands their loss or grievances. However, it's crucial to address the potential pitfalls. Reactions and judgments from others can act as a deterrent to posting and can negatively impact the grieving process. Therefore, it may be preferable for clients to stay anonymous or manage privacy settings to disable comments from the public. This approach allows them to express themselves freely without fearing negative feedback. Guide your clients on how to use these privacy settings effectively. Show them how to control who sees their posts and how to disable comments if needed. Encouraging them to create private groups with trusted friends and family can also provide a safe space for sharing and support. Social media can be a powerful tool for younger clients coping with grief. By using it mindfully and protecting their privacy, they can find a supportive outlet for their emotions. As therapists, we can play a crucial role in guiding them through this digital landscape, ensuring they have the tools they need to navigate their grief in a healthy and supportive way.
Our final recommendation is to utilize social media as a resource for clients to gather information. Studies have indicated that the possible outcome of having a positive experience seeking information about a loved one's passing can significantly improve their ability to perceive the act of seeking out that information positively. In other words, if a client learns that there is a way of gathering information positively, it may give them a better experience gathering information. Clients can use social media to learn more about the grieving process from others experiencing similar situations, which could also provide an opportunity to join a supportive community. Social media platforms can be a goldmine of information for grieving clients. Many platforms offer private or public support groups specifically for those experiencing loss. These groups can connect clients with others who understand their situation and can offer valuable advice and support. Additionally, social media can be a resource for finding professional help. Therapists and counselors often present on social media, providing information about their services and specialties. Clients can use this information to research therapists specializing in grief counseling. The field of grief and social media is constantly evolving. New research is published all the time, shedding light on the best practices for using these platforms to support grieving individuals. As clinicians, it's important to stay up to date on this research so we can provide our young clients with the most effective support possible. By staying informed about the latest findings, we can ensure we're using social media to foster healthy grieving and empower our clients to connect with the resources they need. We encourage you to explore more resources that will provide you with valuable information on grief and social media, including recent research findings, best practices for online support groups, and directories of therapists specializing in grief counseling. And remember, by learning and growing together, we can create a supportive environment where this generation can navigate loss in a healthy and empowered way.
Together, we can make a difference.